A seguir, você confere o vice-presidente da JCI, Paul Van Ostenberg, que vai mostrar as mais recentes estatísticas sobre os eventos adversos no mundo e a importância da mensuração e das ações preventivas para a segurança do paciente.
Greetings. I'm Paul Van Ostenberg, Vice President for International Accreditation and Standards at Joint Commission International. I will be participating in the second International Congress on Accreditation this 15th and 16th of August in Rio de Janeiro. This Congress is jointly presented by the Brazilian Consortium of Accreditation and Joint Commission International. The program this year takes a very timely and important look at the methodology of accreditation, especially as it relates to an aging population in economic times in which healthcare expenditures are being very carefully controlled. In particular, the program will examine patient safety issues in this new future for healthcare. Now, Brazil is not immune from these issues. Brazil's elderly population stands at 14 million, or about 8% of the total population, and is expected to increase dramatically 300% to 30% of the population, or 49 million by 2050. While a healthy lifestyle has always been a social and Ministry of Health goal, the proportion of the population with chronic disease, multiple medications, poor eyesight, and other disabilities will continue to rise. One area we'll be examining closely at the Congress is adverse events in healthcare. These type of events that can cause longer hospital stays, pain, disability, and even death. The impact of such events is on the patient, their family, and of course the caregiver team. In most cases, such events can be prevented. So let's examine one such event. The standards used by CBA and JCI in Brazil include 6 patient safety goals. I'd like to briefly highlight one of them here. That goal is to reduce the risk of patient harm from falls. A very common occurrence in aging population is falls because of chronic disease and multiple disabilities. The data on your screen is from the Joint Commission Event Database and shows an increase in the number of falls over the last 15 years. These falls resulted in death or permanent loss of function. So this is not a record of all the falls, just the most serious, the ones that resulted in death or permanent injury. A 2009 study in Brazil showed a prevalence of falls in the elderly population of about 28%. The number resulting in death or loss of function was not included in the study. The data you now see is more interesting. The fact that when an analysis was done of each fall that resulted in death, the most common cause was the failure to adequately assess the patient for their risk of falling when they came to the healthcare organization. Fall risk assessment is an easy and common practice. You might be asking, why is it not routinely done? For the answer to this question and many other questions regarding quality, patient safety in an aging population, we encourage you to attend the Second International Congress, and I thank you for your interest in this topic.